Hi guys, welcome back to my channel. This is Chloe and I thank you so much for clicking on today's video. On today's video, first off, I wanted to thank you guys so much for all the support on the last video, for leaving all of your questions. I've been reading your comments. I've actually read a lot of your comments, so I thank you so much for leaving all the questions. I will be making a Q&A very soon, and that's coming up for sure. But today I'm going to be discussing a different topic that ever since I've started a YouTube channel, this was a topic that I wanted to discuss, and it's something that I really want to bring awareness to by sharing my experience. And yeah, I'm just gonna talk about it, I guess. So today I wanted to discuss my experience with OCD and how I live with it, how it looks like for me. And my hopes is to bring any type of awareness to the disorder and just to destigmatize it, because I feel are a lot of misconceptions in society about what OCD looks like and how it kind of like appears in different people and how um, the symptoms are. And I think that it's a very misunderstood disorder, and I just wanted to share my experience in the hopes that maybe someone that's struggling with the same thing or maybe very similar subtypes than mine, that you're not alone, that there's always help and there's always treatment available out there for you that will help you. So yeah, without further ado, I'll get started with the video. First, I want to give like a little disclaimer that this is not the OCD experience. This is Chloe's, my OCD experience. And as I said, OCDs represents and appears on people with many different subtypes. And it's a whole different thing for every single person that has it. So this is just going to be my experience, and I will be discussing my specific subtypes and how I got help for it. So just to start, if you're not familiar with OCD, or you might be thinking that you have OCD, obsessive compulsive disorder is basically an anxiety disorder that presents in people even from infancy, but it kind of like worsens usually in your 20s. And it's a disorder represented by very intrusive thoughts that are called obsessions, and um, different things or actions that you do to combat those obsessions and to feel like a release or to feel better, which are called compulsions. Compulsions can be mental or they can be physical. I have both, and they suck because they kind of relieve stress, but they only do it temporarily because the obsessions keep coming. And of course, it represents in different degrees and with different subtypes. And for some people, it is incredibly crippling, and it's just very difficult to deal with. I think the subtype that is mostly shown in media, like movies or books, is probably cleanliness and like washing your hands and like hygiene, like hyper hygiene to the point of like obsessive hygiene. And of course, that is a very much valid OCD subtype, but it's not the only subtype. And so if you might think that you have OCD, I don't encourage you to watch this video to self-diagnose. Self-diagnosing is really dangerous. You shouldn't do that. But you should absolutely consult with a professional if you feel like maybe you're experiencing any of the subtypes that are out there. There are many different subtypes, and there's always going to be a professional available for you to just guide you and walk you through and to see if you actually have OCD and how to treat it. In my case, everything kind of like started originating when I was a kid. I think my first OCD symptoms started appearing when I was around 8 or 9, which is incredibly confusing for a kid, as you might imagine. I started having compulsions and obsessive thoughts and compulsions very early on. The trigger for me when I was a kid would be symmetry OCD. Symmetry OCD is a subtype of OCD where you feel like you have to do things in a very symmetrical way or else. Like that's a very common thought with obsessive tendencies in OCD. There's this belief of I need to do this or else, or something really bad is going to happen. And it could be like from very intrusive thoughts that turn into compulsions to very irrational things that don't really make a lot of sense. So let's say I was playing with other kids in, I don't know, school, and one of the kids would like touch me on my right arm. I would have to touch my left arm to feel that there was a symmetry in my body. And if I didn't do that, I would feel like I would collapse. Like I would feel like I would lose my shit. And I know that sounds incredibly weird and silly, but it is something that a lot of people with OCD struggle with. I still have that subtype of OCD, but just way less. It kind of like got reduced throughout the years, but I do struggle with it pretty frequently. I would say it's on one of my many subtypes, and it's definitely one of the subtypes that doesn't bring me as much distress as maybe other subtypes that find more crippling in my life, or my current life at least. And I struggled with this type of OCD my whole, I would say, childhood life, like from 8 to probably 14. It was very dominant, this type of OCD. And it got worse with time, I would say. And now it's kind of like a part of my life, but kind of like running in the background because, as I said, I think I have worse subtypes than this. But another subtype that I experienced of OCD was trichotillomania. So trichotillomania is a whole disorder in and of itself, but I struggled with it for a while. I actually went through a very traumatic surgery when I was 13 in 2010. And that surgery was successful, but it created a lot of trauma that I was trying to process and deal with. And as an effect, I started having incredibly obsessive thoughts around that surgery, and at that time in my life that was really dark, and I started pulling my hair, and I lost a significant amount of hair that I never got back. It was like irreversible damage to my hair. I did a lot of therapy back then to combat these compulsions to pull my hair, and also because I was just not having a good time in general. I was really, really struggling. I did psychoanalysis, and at the time it really, really helped. But yeah, those were the subtypes that I was struggling with around this time in my life. I would also struggle with just very obsessive thoughts and mental compulsions about death and about like very terrible things, like very negative thoughts that you feel very shameful for feeling. And that happened throughout my teenage years and my childhood years quite a lot. It was pretty crippling, I would say. And then I became a teenager, and by the time that I was 16, I started struggling with what ended up being an eating disorder. So, trigger warning, I will be discussing eating disorders, especially restrictive eating disorders. I developed atypical anorexia, which is basically regular anorexia, but just you are like a healthy weight. I don't know what that means, but it's like your BMI is still healthy for your height and your age and your gender, but you are not healthy with your habits at all. Your mentality around food is terrible. And so it took me a lot of years in therapy to actually understand that what I was struggling with just a different subtype of my OCD. That, of course, it was an eating disorder and a problem in and of itself, but they were very much correlated, and it was just, a subtype of my OCD. So the obsessive thoughts would be, surrounding my body, the way that I looked, how out of control I felt, about the way that I felt, the way that I looked, and I also had very severe, and I still struggle with body dysmorphia. But at that point, it was like very bad. And I remember I started to, as a result of all this obsessive thoughts, really, really centered on my body. I felt like they could be controlled in a way, like that lack of control about the way that I looked, I could control it in a way. So I started compulsing and restricting my calories a lot, counting calories very obsessively, and like it's like compulsions are really hard to explain, because I feel like obsessions and obsessive thoughts are involuntary and intrusive, but compulsions are as well. Like they feel very uncontrollable. And I would feel like if I didn't count my calories all the time, and if it wasn't an incredibly low number for my age and my composition, something really bad would happen, in this case gaining weight, or like not controlling fully the way that I looked. When of course in reality your objective mind is like, who cares if I gain 5, 6, 20 pounds, like it doesn't really matter. What actually matters is being healthy and having a balanced relationship with food. But I would get into these processes of just incredibly unbalanced behaviors when it comes to food consumption and just the way that I looked, etc. So that was pretty much and it's still a subtype of my OCD. My eating disorder is something that I still struggle with lately, and I got comments on my last video asking me to, hey, can you please do my eating disorder experience? And I will make sure I'll do that once I fully recover. I'll be honest with you, I am not a person that's 100% recovered. I am in recovery. I have been in recovery for a while, but I'm not at a place where I can sit here and talk about that story without getting overly emotional and just distressed, because it's something that I still struggle with and I battle with mentally so much. And I don't think I'm ready to discuss that part of my life on the internet yet, but one day I will. So my eating disorder, very big subtype of my OCD. But I also throughout the years developed relationships, romantic relationships. I've had 3 boyfriends, my current boyfriend and 2 ex-boyfriends, and with them I developed what I would say is relationship OCD, which is incredibly annoying, but it's so bad, which falls under the category of pure O, because pure O basically means you're purely obsessive with mental compulsions. So basically you're not doing any rituals, like physical things that you do that look bizarre, but you obsess and compulse in your mind. So the obsession would surround something in the relationship that causes you any type of uncertainty. And it could be specific situations that happen with your partner that cause any doubt or questioning or worries. And because you have OCD, you don't deal with it correctly. Like, you don't deal with it in a healthy way. So a healthy brain would be like, okay, this situation is giving me anxiety. This situation is worrying or confusing. I need some clarification. So I'm going to ask this from my partner, and I need reassurance and just clarification. And in a good relationship, your partner will provide you with clarification and will make you feel better, and it will show you evidence that everything's okay and that there's nothing to worry about, which is what currently happens in my relationship. But the OCD kind of like cripples back in. So you feel like, because you're already assuming the worst and you're so concerned because the uncertain and like the lack of control and uncertainty is so unbearable, you already assume the worst has happened. So it's really hard for people with relationship OCD to trust their partners. Sometimes it's really hard for them to let go of the idea that everything's wrong in the relationship. And so any sign of uncertainty or doubt in a relationship is already in your mind the worst case scenario. So it makes you spiral. You have a lot of obsessive thoughts about your partner not loving you, your partner being unfaithful, your partner, all of these things that, your worst fears. And what ends up happening is you over rationalize these things afterwards. You're like, but they said this and this and that, so it means that they didn't cheat, so it means that they love me, so it means that there's nothing to worry about. So that's the compulsion, right? It's mental. You're like, you over justify and over rationalize everything that happens because you want to make yourself feel better. It's kind of like a reminder of, hey, this is reality, this is what your partner told you, you need to relax. And then the obsession comes again, and then the compulsion comes again. So compulsions in this type of OCD make a lot of sense, but at the same time they don't. Like, I can rationally understand why a compulsion would happen, because you feel so unhappy with the uncertainty and you're so out of control, you assume the worst, and the obsessions keep coming. And the only way to stop those obsessions is to rationalize and overly rationalize, but the rationalization also gets out of control. So that's what I mean when I say the obsessions are very exhausting, but the compulsions are as well, because you're consistently obsessing and compulsing, and it starts with the specific issues that you faced in your relationship, or the specific doubts, or the specific situations that you were like, what's going on here? And it spreads to everything, and then you question absolutely everything about the relationship, like to a very stupid degree. I experienced this in all of my relationships, and I think it has happened, like with my first boyfriend, for example. It was more of like the obsessive thoughts would revolve around, do I love him? Am I in love with him? And then like rationalizing why I love him, and do I love him? Like that would be like the constant obsession and compulsion, even though the relationship was pretty good. It was a really decent relationship. We were just kids. That's why we broke up, but it was a very, very good and healthy relationship. And with my last ex-boyfriend, it wasn't a really good relationship, and there was a lot to worry about. But the OCD was so extreme that I couldn't clearly see through the issues, because everything was the worst case scenario, but I couldn't let go because I kept obsessing. Whereas if I had dealt with the OCD properly, I would have probably be able to have distanced myself and be like, hey, this doesn't add up. And it's not because of my OCD, it's because it doesn't add up. That's what your relationship OCD does to you. It blurs everything into the worst case scenarios. So the smallest things will be terrible and the bad things will be terrible, but it keeps you in this loop of a horrifying behavior where you can't really think straight. Like, it's really hard to be objective. It's really hard to listen and understand your partner, because everything is already the worst case scenario. Whereas when you deal with your OCD and you're in treatment and you get help for it, you can actually very accurately distinguish the situations where, like, because uncertainty and doubt in relationships happen all the time. That happens in any relationship. It could happen in the best relationships, and it doesn't necessarily mean that there's anything wrong in the relationship. So in a healthy brain that can analyze the situations critically and, healthily, you'll see those situations, you'll bring it up with your partner without assuming the worst, and then you'll evaluate, okay, this person is giving me rational explanations, I shouldn't worry about it, I'll let it go. And if the explanations don't add up, then you'll be like, okay, this shit doesn't add up, we need to break up, or we need to take a break, or we need to talk about it. But the obsession part of it makes you think that everything is already the worst case scenario. So it's unbearable, and it makes things pretty much undistinguishable. Everything is the worst case scenario already. So actually understanding with clarity, like the state of your relationship becomes incredibly hard, and that's why it's so important to get treatment, because that makes you kind of push away all of the OCD mentality, like all of the obsession, all of the compulsions, so you can analyze things critically. Whereas when you don't get treatment, you will be stuck in that obsessive compulsive mindset, and everything will be the worst case scenario, which really, really strains a relationship, specifically if the person that you're with is a really good person and a good partner. In my personal case, when the OCD is really, really bad, and especially when I didn't have the treatment, I remember everything would be the worst case scenario, and also that would mean it created a lot of friction in the relationship, but it also meant that from time to time I would be able to see things clearly, especially when I would share my relationship concerns with other people. Everything would be put into perspective, and I could see other people like thinking and telling me like, hey, that's not a big deal, they were very clear with you, they gave you an explanation, you shouldn't be worrying about this. And that's like a little moment of clarity. But if you still have OCD, you'll still spiral. It'll go right back to where it was. So that's the relationship OCD. And my last subtype of OCD is checking. So checking and checking rituals and repetition. So basically, I repeat specific behaviors, like physical behaviors, which are like physical compulsions, and I check appliances in my house multiple times. This is a type of OCD. I'm not sure if I said this, but I don't have this subtypes all at the same time. There's times in my life where it's really, really hard, and the subtypes all coexist at the same time, and it's terrible. And then there's times where it's just mostly checking, and then there's times where it's mostly my eating obsession, and then it's mostly repetition, and then it's mostly relationship OCD, which is usually what happens. It's like it comes in like cycles, but from time to time they kind of like overlap, which is terrible. But the checking OCD is basically I'll check if I locked the door, if I check if I turned off, my stove, and I'll check if there's anything behind the shower curtain for some reason. And even though I know it doesn't make any sense, there's something inside me that says if you don't do this, something terrible will happen. Sometimes it's a very clear fear, like my house will caught on fire, I'm gonna get robbed if I don't lock the door, or there's a ghost behind the curtains, as rational as that might seem. But sometimes it's just a really big hit of anxiety that I can't really explain where it's coming from, and I need to do this or else. I apologize for that awful noise. That's my neighbor doing their laundry, and it's so invasive. Like, I think their washing machine is just so close to my apartment, like to the wall, to my kitchen wall, that it's terrible. I'm so sorry. And so yeah, those are all of my subtypes, and now I want to discuss how I've been dealing with my OCD and what type of treatment I've been getting. So let's just get on to that. There's different types of treatment for OCD. There's people that just do therapy and it works amazing for them. There's people that go on medication because they need it. And I'll just share my experience, but don't ever feel like I'm telling you what to do. Like, that's so personal, and you really need to explore your options when it comes to help with OCD, because there's no right answer. There's things that really work for some people, and then there's things that absolutely don't work for other people, and that's just the reality. Are you fucking kidding me? That fucking noise. Fuck. It's every time that I decide to film. As I was saying, this treatment that I got for OCD, so basically 2017 was the year that my eating disorder got awful. I can't even explain how bad it was. I did lose a significant amount of weight that was concerning. It was the first time that my struggles were very visible for my relatives and other people. And so I was basically advised to start therapy. It had been a while since I was in therapy. I think it was like 4 years without therapy. And every time I did therapy, it was psychoanalysis. And it really, really helped. So I was like, you know what? I'm going to go back to therapy. I started therapy with my current therapist, and she basically is also like psychoanalysis therapy. And my eating disorder at the time was just so bad that I really needed it, and it really, really helped at the time. I firmly believe that I wouldn't be here and sitting in my apartment next to my sleeping cat, who is my fucking child. I wouldn't have the job that I have right now, which I'm really proud of my job. I wouldn't have the very much improved relationship that I have with my family, the very good friends that I have. I wouldn't have without all of those things without therapy. Not at all. Not a chance in hell. I was miserable. My eating disorder was consuming me so much. And I'm really grateful for all of the years. It's been 4 years since I've started that therapy. But my OCD, I would say throughout that psychoanalysis therapy was still very strong. And I remember bringing up, hey, I might want to go to a psychiatrist. I might need medication. And my therapist didn't really agree with me going on medication. And this is something that might happen to you. You might be having, I don't know, concerns about going on medication, or you really want it. And at the time, I think my therapist didn't really understand that what I was going through was OCD. I think I was having a lot of relationship issues with my ex, and I think those were perceived as, relationship anxiety, which it was, but it was also like insane OCD that I feel, because the relationship was wrong at the time for me. If I would have gone on medication, I probably would have broken up with that person much earlier without putting myself through that process of obsession that was just so bad. But I think my therapist had kind of like an orientation of kind of, let's talk about the cause, let's talk about the root issue. And I completely understand where my issues come from, and I understand that they're coping mechanisms, that they are completely irrational. And I am very much in touch with, I'm very conscious of my OCD, and I'm also very conscious of my trauma. So I started to realize that I still wanted to go to a psychiatrist very recently, because my relationship OCD got out of control. But I also thought, I'm having a really bad time now. But when was the last time that I was very stable? Like, I started to go back in my mind, and I thought, I've been struggling so much, and I've been kind of like naturalizing and like making it, like normalizing it, because you get so used to it at some point. Like it was just so bad, because like I got so used to my eating disorder, I got so used to my checking OCD, that I was like, oh, this is normal, this is fine. And then relationship OCD is so exhausting for me. It's probably one of the most crippling out of all of them. And I think I decided to go for medication recently, even if I didn't, my therapist didn't agree with me, because I started to realize how much OCD was affecting my life. It was affecting my communication with my friends. I wasn't talking to them anymore. I was in a very dark place, and I was also not communicating with my family. I was not leaving my apartment at all. I was not able to keep up with cleaning my apartment. Like, it just got in the way of my everyday life. I wasn't being very productive at my job at all, like to the point where I was very concerned about like keeping my job. So I was like, I need help. Like, I really need help. And with relationship OCD, it's very, very crippling for me. But hand on my heart, if I think about my other subtypes, there has been times and cycles of my OCDs and my other type of subtypes of OCD that have been incredibly crippling as well. Mostly my eating disorder and the checking OCD have been really, really bad. So I thought to myself, I'm not only going to go to a psychiatrist to get assistance and help for this and get treatment for this, because relationship OCD is the most crippling one, but I'm also going to do it for all the subtypes that I've completely normalized, and I don't want to normalize in my life anymore. There came a point where they still cause, like all of my subtypes still cause emotional distress, but I got so used to them that they kind of felt like part of my personality, and that thought really scared me, because your eating disorder is not a part of your personality. I don't care what anyone says. Checking your appliances 80 times, it's not part of your personality, girl, and you deserve the help and the treatment. And I think maybe the relationship OCD, because it involves someone else, it was the most clearly distressing, because it's a dynamic. A relationship is a dynamic between two people. But at the same time, it was kind of like my wake up call of like, hey, you need help with other things too, and it's time. So I am currently on antidepressants and anxiety pills, and it's been great. And one thing that my psychiatrist has said is, treatment for OCD is not curative. You're not going to get cured of OCD. You might experience obsessive thoughts from here and now, but it's going to be way less, and your quality of life is going to improve a lot. And my psychiatrist also recommended I started cognitive behavioral therapy, which is not the same as psychoanalysis. And it's kind of like exposure therapy, where basically you trigger yourself to get exposed to the anxiety that uncertainty causes you. And you have to sit with it, which is like scary and just so unpleasant. That sounds so unpleasant, but it is literally what you need. Because with psychoanalysis, I'm not saying that it doesn't help, because it did help me in many ways with many things, but with OCD specifically, in my case, I remember it was always, let's go back to the root. Let's go back to the trauma that's causing you have it is causing you to have OCD as a coping mechanism. And I go back to the trauma all the time, where, at some point I was like, I'm so familiar with it. Like, I know exactly why I do it, but I just can't stop, and I need help stopping this behavior or reducing the behavior as much as possible. And when it does happen, I need to learn how to stop the compulsions, because even if the obsessions, I can't stop them sometimes, I need to help myself and stop the compulsions. So that's what I'm doing right now. I am currently on medication, and I'm on the lookout for a cognitive behavioral cognitive behavioral therapist, which I've been recommended a couple, and I have a couple of appointments coming up just to see which one I choose. I'm really excited for that, because I feel like it's what I need at this time in my life. And no shade on psychoanalysis, it helped me so much, so many years. Since I said, I wouldn't have the things that I have, and I wouldn't have the life that I have, the growth that I fucking had in the last 4 years, if it wasn't for my therapist. But I think it's also important to understand that you might not agree with your therapist on everything. You might need a different type of therapy, and sometimes some professionals are incredibly good for specific times in your life, and for specific disorders you might need a different therapy or even medication, and that's not scary. I used to be so scared of medication because there's a lot of stigma around it, and I was told even by mental health professionals that medication is terrible, that it fucks with your brain, and all of this horrible, stupid shit that you're like, some people really need it. And there's nothing shameful about needing medication. There's nothing shameful about going on medication, okay? It is completely up to you to go and make a consultation if you feel like you need it. If it's getting in the way of your life to a degree where it's crippling, you want, and you want to make that consultation, there's absolutely no shame in it whatsoever. So that's my OCD story, guys. I really hope to bring some sort of awareness to the disorder, and maybe some perspective about like how the disorder manifests. And it's not an easy thing to deal with, and the obsessive thoughts and the compulsions are not completely gone, but they're pretty much very much reduced. And my quality of life, oh my god, it's just it's so much better. And if anyone is really struggling, and you're really someone's watching, and you're really in the thick of it, I feel you, and I'm so sorry that this is happening to you, but there's help out there. There's always help, and help looks many different ways. It could be medication, it could be therapy. It really depends on what you need and what will help you, and that's completely your journey. And anyone that bullshits on your journey, fuck them. Honestly, fuck them. So that's it. That's my story, guys. Thank you so much for watching. For the next video, I will be making a Q&A with all the questions that you left. If you want to leave any more questions under this video, they're going to be well received as well. I will include them in the video. But yeah, thank you so much for watching. I hope everyone has an amazing weekend, and I will see you on the next one. Love you guys.